Hello and welcome to UroChannel. This is a video on erectile dysfunction due to veno-occlusive issues upon special request of one of my viewers. His name is PH. I think it is a very good topic because venous leakage is a very common problem in erectile dysfunction. My name is Stefan Buntrock. I'm a urologist and sexologist. If you haven't done so, please subscribe to my channel for more information about urological topics. If you're watching from Germany, I recently started a channel in German by the name of Urologie. So let's dive right into the fundamentals of erectile function. For erections to happen, a couple of things are necessary. A trigger is needed for the process to start. Usually it is sexual desire and sexual arousal. Or, alternatively, during REM sleep, a similar effect can be observed. If you want to know more, here's a video about sleep-related erections. The next thing that has to happen is massive blood flow from the penile arteries, flooding the corpora cavernosa of the penis with blood. These have to respond with relaxation, because otherwise the blood will leave the organ again. The cavernous bodies consist of smooth muscle. When smooth muscle relaxation happens, they will fill with blood. And then, of course, the blood has to be kept somehow inside the penis. This is achieved by closing off the veins of the penis. Nature has been quite ingenious. It has placed the veins directly beneath the tunica albuginea. This is the white stuff wrapped around the cavernous bodies. It is like a very firm stocking that gives resistance when the pressure inside the penis is rising. What happens next is that the rising pressure inside the cavernous bodies compresses the veins against the tunica albuginea. So the outflow of blood is shut down and blood is finally trapped inside the penis. The rest is physics. The increasing pressure makes the penis erect and rise. Erectile dysfunction due to increased venous drainage of blood is called veno-occlusive erectile dysfunction and is a common condition. And it becomes apparent that there may be different reasons. You might recall the mechanisms involved in a normal erection. Now, principally, veno-occlusive ED can happen at any point, directly and indirectly. If there is reduced arterial inflow due to atherosclerosis, drainage from the penis will not shut off quick enough. Result, indirect veno-occlusive erectile dysfunction. If the smooth muscle of the corpora cavernosa fails to relax, veno-occlusive erectile dysfunction. If smooth muscle gets lost or is transformed into connective tissue, something which we call fibrosis, primary veno-occlusive erectile dysfunction will happen. So what is causing this? In short, Western lifestyle and its consequences together with aging. I'm talking about a sedentary lifestyle with a Western diet, high on fat, sugar and salt, together with excessive alcohol consumption and smoking. This will lead to weight issues, hypertension, diabetes, hyperlipidemia, in short, features of the metabolic syndrome. All of this is damaging smooth muscle and the architecture of the blood vessels. Certain diseases might lead to veno-occlusive ED too, like prostate cancer and its treatment, because during the months following radical prostatectomy, very often there are no erections. This results in loss of smooth muscle that becomes visible to the naked eye by penile shortening. Therefore, penile rehabilitation is meant to counteract this process. I already uploaded some videos about that topic. Treatment. It depends on the underlying problem. Smoking is a substantial contributor to venous leakage. To quit smoking is a simple solution, as it is likely to have a positive effect. If smooth muscle has been lost or become fibrotic, this is difficult to treat. A cock ring or vacuum pump might be the solution here, but as you can see, we will need some mechanical aids for this. PDE5 inhibitors like Viagra and Cialis can always be tried, by the way. If you like this video, hit EuroLike and activate the bell. Thanks for watching. Bye bye.